Thank you. Good afternoon. My name is Helena Galli. I'm a second-year medical student at the University of South Florida in Tampa. I'm truly grateful for the opportunity to be here today. I will be sharing the results of our case study on the effects of CO2 laser therapy in treating scleroderma-related lymphedema. This project was done under the mentorship of Dr. Thomas Beachkowski at the James A. Haley VA in Tampa. As a background, lymphedema is a prevalent issue in the United States. It is commonly secondary to malignancy and cancer therapy, but is also observed in systemic sclerosis due to the loss of lymphatic capillaries in the later stages of the disease. The result is a functional impairment and a poor quality of life. The standard therapy for lymphedema is decongestive therapy, which involves manual lymphatic drainage and compression bandaging, but this approach presents with barriers that may result in reduced patient adherence. Following CO2 laser therapy, we observed an improvement in the functional limitations of chronic lymphedema associated with systemic sclerosis. CO2 laser therapy has also been effective in treating other fibrosing conditions, which I will briefly discuss. Our case involves a 64-year-old woman with anti-centromere-positive systemic sclerosis. She presented with stage 2 lymphedema and severe induration of the anterior shins, perioral skin, sclerodactyly, and a non-healing digital ulcer. As a result, she experienced limb discomfort of the lower extremities and difficulty chewing. She was not on any immunosuppressive agents based on the medical decision of her other providers and could not commit to the frequent compression garment use for her lymphedema. Our goal was to use CO2 laser therapy to improve this patient's range of motion by reducing cutaneous fibrosis. We did not intend to use laser therapy to directly treat her lymphedema. The patient was treated with 3 sessions of deep FX fractional CO2 laser therapy over 13 months for the anterior shins, followed by topical triamcinolone. The result was an immediate improvement in range of motion and limb induration, as well as a 20-degree improvement in plantar flexion and a 10-degree improvement in dorsiflexion. Surprisingly, we also observed an extrusion of subcutaneous lymphedema through the channels created in the skin by the laser during treatment. The lymphedema eventually reaccumulated months later, but not to the same extent as before treatment. This is a picture of what we saw. We observed lymphedema leaking through the channels created in the skin by the laser treatment during the sessions. The key question is, did treatment improve lymphatic drainage, or is her improved mobility the result of reduced cutaneous fibrosis and more pliable skin? We do not have the answer to this as of yet. For the treatment of the perioral region, she was treated with 4 sessions of alpha FX fractional CO2 laser therapy over 5 months, also followed by topical application of triamcinolone, which resulted in a significant improvement in the range of motion of the mouth and jaw and increased skin pliability. Briefly, while we were treating her sclerosis, there were other utilizations of fractional microablative resurfacing to treat her calcinosis cutis-related digital ulcer. We also used infrared light to improve sclerodactyly and augment hand mobility. Other reports of CO2 laser therapy for fibrosing conditions in the literature include graft versus host disease, radiation dermatitis, lichen sclerosis, and keloids. Overall, CO2 laser therapy reduces limitations in movement. In conclusion, this case prompts consideration of CO2 laser therapy as an alternative intervention to relieve the physical limitations of lymphedema and systemic sclerosis, as skin resurfacing with CO2 laser therapy offers the prospect of improved skin pliability, texture, and functional outcomes, ultimately contributing to enhanced quality of life. However, future studies are needed to ascertain the effect of CO2 laser on lymphatics to determine the role of laser therapy in lymphedema treatment. That is all I have. Thank you for your attention.